for joining us today. The meeting is going to be recorded, so you'll probably just see a pop-up on your screen for that. Again, welcome to our fourth biannual collaborative convening. If you haven't already done so, please enter your name and organization or agency in the chat for us. That just helps keep track of who joined us for sending out information and such. A few housekeeping for us today is, like I said, it is being recorded, so if you could just make sure you remain on mute during the entire presentations, that will help us in the recording to be able to share out to others that may not be able to join us today. And of course, utilize your chat if you have any questions or any concerns or comments that come up that you want to add to that, feel free to do so. So we know preventing child maltreatment and strengthening families require more than a single public agency or service strategy or even a series of targeted prevention services. In order to achieve our missions and our vision to promote strong Oklahoma families together, we must in partnership strengthen families and prevent child maltreatment and family separation and trauma to children and their parents. We know reaching children and families sooner through prevention is the key to avoiding trauma, disrupting intergenerational cycles of maltreatment, and achieving better outcomes for children and families. The safety and well-being of children and of all family members is paramount. When safety can be ensured, strengthening and preserving families is the best way to promote the healthy development of children. Oklahoma has been investing in a comprehensive continuum of prevention and community-based supports and resources for children and families. And in doing so, Oklahoma is transforming into a child and family well-being network in collaboration with many of you that are on today's call and many others that weren't able to join us to support and strengthen safe and healthy children and families. We hope, and Kat, if you'll go to the lineup for the agenda, we hope that the speakers and the information that we will share with you all today will highlight just a few of these partnerships and investments being implemented in Oklahoma. As you can see on your screen, we will have Secretary Brown welcome us. Unfortunately, he was not able to join us live, but we do have a taping of his welcome and a few updates for him, for everyone. And then we'll move through to our presentations that we hope, again, will be just a highlight of some of those partnerships and investments for you that is happening in Oklahoma. So I'm going to turn it over to Sherry Trice with the Oklahoma State Department of Health, and she's going to share the video of Secretary Brown for us. So Sherry.
Greetings, my name is Justin Brown, Director for the Oklahoma Department of Human Services and Secretary of Human Services for the state of Oklahoma. It's hard to imagine it's been 6 months since our most recent update on progress around Oklahoma's state plan for the prevention of child abuse and neglect. But welcome to this conversation. I am really thankful not just to be here with you all as friends and partners, but for the other agency type partners who are engaged in this work with us. Of course, at the head of that pack alongside DHS is the Oklahoma State Department of Health, and the partnership we have in the work around prevention of child abuse starts with them, and we are certainly thankful for their participation, their help in addressing child abuse and neglect. It's funny when they asked me to provide this welcome, it was essentially an invitation for an open mic around child abuse and neglect prevention. And so sometimes that can be dangerous when it comes to an open mic. So I started to think about what prevention of abuse and neglect means to me. And the first thing that comes to mind is partnership and is collaboration amongst systems that have to work together to address the prevention of abuse and neglect. And those are systems, some of which we operate. For example, some of the early childhood systems that we engage with here at the Department of Human Services. And so one of the things I wanted to talk about was, and provide you a quick update on, is this Oklahoma clearinghouse for early childhood success that we developed about a year ago. It was late December of 2020, I believe. we launched the Oklahoma Clearinghouse for Early Childhood Success. And the idea was to build an evolving definition of quality in early childhood. So we brought together partners from all over the state of Oklahoma to build this clearinghouse that would allow for us to look at new research, whether it's from the state of Oklahoma or national or even globally, and think about how to implement that research on the ground in early childhood settings like child care providers across the state. So we launched. We also then built a formal, sustainable framework for the clearinghouse, and we worked with Oklahoma Partnership for School Readiness, a fantastic partner, in moving that clearinghouse from the Department of Human Services to OPSR. So we're thankful for their partnership and the success that they have sort of developed from that transition. So we've executed on the first round. There are 4 topic areas that both researchers and implementers, which are actual on-the-ground providers in childcare and early childhood, they evaluate the research in 4 different topic areas. Those topic areas are social emotional well-being, healthy homes and relationships, childhood developmental stages, and equitable distribution of resources. And so the first round of research evaluations is complete. That round was on the topic area of social emotional well-being. I think it was something like 8 or 10 projects made it all the way through to the final subcommittee, which is the Public-Private Partnership Subcommittee, where the Department of Human Services sits alongside our partners in philanthropic foundations to evaluate the needs for funding for deployment of these projects on the ground. Super exciting stuff. And we actually, I don't think the awards have gone out yet, so I can't tell how many, but we at the Department of Human Services awarded millions of dollars in funding for the deployment of some of that research to actual providers in Oklahoma, so that our child care providers could be given tools that they need to understand, recognize, and to help to promote social emotional well-being in our youngest neighbors and Oklahomans in early childhood settings. So that was really incredible to be a part of. We're thankful for that Public-Private Partnership Committee, because that committee and its foundation partners also provided funding for those projects as well. So it's a true illustration of what can happen when government, public sector agencies work right alongside private foundations in joint mission to serving our kids. So I thought you all would be interested in the most recent development around the Oklahoma Clearinghouse for Early Childhood Success. Other systems that are important for child abuse and neglect prevention that immediately come to, actually I've got a couple of things here. One thing I wanted to talk about is really along the concept of moving upstream. So of course we talk about partnership and prevention, but also prevention really is looking at some of the worst outcomes in our systems, some of those being in our agency, in the Child Welfare Division. We would prefer to get to the space in which we never get to know families in child welfare. We actually get to know them earlier in our Adult and Family Services Division, which is our Social Safety Net Division. So a couple of projects I wanted to mention to you that you may have interest in this idea of moving upstream and meeting families before they become in crisis is the TANF investment strategy that we also launched about a year ago. And it's sort of a similar concept in that it aligns government public sector agencies with private foundations. We built a TANF Investment Advisory Committee. It's important to share that TANF stands for Temporary Assistance for Needy Families. It's one of the federal block grants that we operate. But the TANF Investment Advisory Committee is made up of, I think it's 18 to 20 private foundations, sort of the largest philanthropic partners in our communities. And the intent was for them to understand the goals of TANF and for them to share with us organizations and projects that we could look at investing our TANF block grant in that would help to promote outcomes in Oklahoma. Those are outcomes around poverty, which of course we know is such a high, there's such a high correlation between the sort of calls that we received around child neglect and poverty. So we wanted to move upstream and try to address poverty so that we never receive those calls of child abuse or child neglect specifically. So the TANF Investment Advisory Committee brought to us a ton of projects and opportunities. We went out, of course, through formal procurement regulations and the RFP strategy. And at the end of the day, ended up awarding almost $30 million in TANF grants to partners all over the state of Oklahoma. We'll provide some indications of where those went, but that particular topic area was around family stability. So of course, family stability is critical in prevention of child neglect and abuse. And so we were super excited about this really transformational and innovative strategy around TANF funds deployment. The next round, the RFP is close to being launched, and this one is exciting. It's around youth supports. So organizations in our community will be applying for TANF grants to help to fund community opportunities to help provide youth supports in our communities. So keep your eye out for that press release, and we're looking forward to the next round of grants. The last thing I wanted to mention to you, which is to me a really great opportunity in the space of child abuse prevention and neglect prevention, is this concept around changing the distribution model for human services. Our desire is to meet our families where they are before they become in crisis. And that means we can't expect them to fall to a level of despair to reach out to state government and ask for help. We need to meet them where they are with our safety net division called, again, Adult and Family Services. And so we are not only embedding our teams in the community, you may have, you may not have, but hopefully you are seeing Oklahoma Department of Human Services workforce spread out all across the state of Oklahoma in places like homeless shelters, in schools, in law enforcement offices, and food banks, really intending to meet people in need and at risk in their communities where they are, so that we can help solve for some of those earlier problems before those issues become greater. So you see our embedded worker strategy starting to be deployed across the state of Oklahoma. And then the main thing I really wanted to share with this is the concept of our Hope Center platform. So in March 11th, I believe was the date, we soft launched the first ever Workforce Hope Center in Oklahoma. And the idea was to wrap resources around existing providers. We did this in the pandemic around youth development providers like Boys and Girls Clubs and YMCAs and urban leagues, where we wrapped resources so that they could serve in greater ways. Well, now it's time for us to evolve that model and wrap those resources around providers in the workforce space. So as folks need to maybe look at being upskilled, moving from a low income or a low wage job into a more professional job that not only takes time and commitment to those workforce training programs, but it takes us and organizations like us to help remove barriers from people for that long-term engagement. We know when people want to try to engage for 6 or 8 months in a training program, life gets in the way and in some cases prevents them from engaging for the long term. And that long-term commitment is what it takes. And so what we're doing is we've built this first ever Workforce Hope Center so that we can wrap resources around workforce providers. So now when you engage in a long-term program, we solve for things like on-site childcare, connection to additional resources through state government agencies like DHS and OESC for unemployment insurance, and Housing Finance Agency for housing vouchers, and Health Department for WIC. Lots of those other wraparound programs that we need to provide. But we also have on-site mental health resources in a safety net clinic, just really all of those things you can think about that would prevent somebody from engaging in long-term workforce upskilling and retraining. We solve for that on-site with consistent case management, all equipped and connected by technology through Be a Neighbor. So really exciting developments there. It is that first ever Workforce Hope Center is now open at 10th and Rockwell here in Oklahoma City. The second one is scheduled for North Tulsa. We have strategy for another 20 to 25 more projects as we unlock funding through different sources. So excited about what that means for family stability, for helping to address poverty in Oklahoma, which is such a driver of poor outcomes in our state. So with that, I'm just sharing a few updates. I'm welcoming you to this convening of parties interested and committed to moving to our state to a space of prevention in child abuse and neglect. So thank you so much for engaging today. Thank you for the other organizations and speakers who are here. I saw the list of folks who were speaking, and I'm excited to catch the replay. Unfortunately, I can't make this the rest of the day, but I'm excited to watch the replay because there's a lot of good friends and resources who are here helping to update you all on where we stand. So thank you all for your participation. Looking forward to the next time we're together.
We hope that gave you just a little taste of what is happening in the state of Oklahoma from the OCCY as well as the health department and many of our partners. And we're going to move into sharing some of that work as well with our presenters today. We're going to bring up Danielle Dill with the OCCY and the Parent Partnership Board. And her colleagues are going to share about that board as well as some information on how to include parent voice and those with lived experience in the work that we're doing. So Danielle, are you ready?
I am ready. Thank you so much. Well, good morning. Again, my name is Danielle Dill, and I serve as the program manager for the Office of Planning and Coordination with the Oklahoma Commission on Children and Youth. Thank you to our friends at OSDH and OKDHS for the opportunity to present today, and thank you for your continued support of OCCY programs and services. Today, we're going to be talking about strengthening families through parent voice and specifically about OCCY's Parent Partnership Board. Presenting with me today is Sunny Jamerson. Sunny serves as a Parent Partnership Board with the Commission. Also presenting is Taylor Kanuheisen with the Oklahoma Partnership for School Readiness and Kara Georgi with the Children's Trust Fund Alliance. Next slide, please. Today's key takeaways include we're going to talk about what are parent partnerships, why do we want to partner with parents, learn about OCCY's Parent Partnership Board. We're going to hear from Sunny, again, who is a member of our board, and get her perspective and learn a little bit about her story. We're going to learn about a unique partnership between OCCY and Partnership for School Readiness that we refer to as Strengthening Parent Voice Partnership. And then last, we're going to learn about resources to support parent and family engagement at the national, state, and local level. We've also set up a Jamboard session. And if you're not familiar with Jamboard, it's essentially a whiteboard where we can share information in real time. And so in the chat, Kara Georgi just posted the link to the Jamboard. You can click on that link. And then when you open up the Jamboard session, on the left-hand side is a little icon. It looks like a sticky note icon. You just click on that and you can post to the Jamboard. And we really want to hear from you. We want to engage with you as much as possible through this virtual environment. And we want to hear from you and learn about what can you do to amplify parent voice throughout the state of Oklahoma, and some steps that you may take to do so in the near future. So we encourage you and invite you to click and participate in that Jamboard session. If we run out of space, there are arrows on the right and left-hand side of the Jamboard, which will add additional pages. At the end, if we have time, we're going to take a look at those responses on the Jamboard. And if we run out of time, we'll be sure to get with our partners at DHS and OKDHS to get that information out to you. But we learn the best from learning from each other. And so again, we encourage you to participate in that jam session. So why partner with parents? Parents who have faced and overcome challenges are critical partners with staff in supporting resilient and strong families and communities. Their life experience, wisdom, and skills are integral to creating high-quality programs and effective policies. Partnering with parents supports meaningful engagement. We develop parent leaders throughout our communities and our state, and it supports program success. Last but not least, it advances equity by engaging diverse community members. It is our belief that parents are the experts, and we want to work side by side with them, share power, co-design, and really value their experience and expertise. They know what their families need. They know their communities, and we believe that parent engagement is necessary. It's not supplemental. Next slide. And because of that belief, OCCY initiated a parent partnership board about 6 months ago. And the purpose of our board is to inform the work of Oklahoma's child serving systems regarding a broad range of innovative programs, activities, research, or evaluation to improve the well-being and reduce the adverse childhood experiences of Oklahoma children. Our board serves an advisory capacity to our commission, to our staff, and to other child serving agencies. And we want to connect those parents with lived experience with our commissioners. And last, our board supports the work of the Children's Endowment Fund of Oklahoma. One of the things that's unique about OCCY's Parent Partnership Board is the direct access that our parent members have to the commissioners. And these commissioners, many of them serve as state agency directors and community leaders representing child serving systems. So there's a unique opportunity to have that direct contact and have the opportunity to really share important information with decision makers and leaders throughout the state of Oklahoma. Next slide. And here's probably the one of the best parts of my presentation today is to introduce you virtually to our Parent Partnership Board. We have 10 great members from throughout the state. Our board was launched in November of last year. We are super excited about the diversity, the richness of the parent voice represented on our board. These parents have direct knowledge and experience in caring for children, and our parents who have children with special needs, who have been impacted by Oklahoma's criminal or juvenile justice system. These are parents who have been in custody or have received services from the Department of, their children have been in custody or have received services from the Department of Human Services, Office of Juvenile Affairs, Department of Health, or other child serving entity, including various nonprofit organizations. And these are parents who have received services, including but not limited to home visiting, SNAP, TANF, WIC, senior care, and other services. And who better to inform the work of child serving systems than those who have experienced and navigated those systems themselves. And so I'm going to introduce each one of them. I think I saw a handful of them actually on this collaborative meeting. So feel free to wave and let people know who you are. Amber Adams from BEGS, Betty Hawkins Emery of Oklahoma City. And Betty actually has just recently been appointed as the co-chair of the Alliance National Parent Partnership Council for the Children's Trust Fund Alliance. So we're so thankful for Betty and her leadership, not only at the state level, but at the national level as well. Delana Sullivan of Pauls Valley. Ike Turner of Oklahoma City. LaShonda Stevens Tatame of Moore. Dr. Lana Turner Addison of Tulsa. Sarah Jacoby of Oklahoma City. Sanaqua Hildreth of Oklahoma City. Sunny Jamerson of Moore, and Tamara Bryan of Pryor. And again, we're just super excited about this group. You can expect great things from them. They are very passionate and have already, in the last several months, presented at numerous events, provided feedback to legislators regarding some proposed legislation this session, and they are ready to work. And now you'll have an opportunity to hear from one of our parents, Sunny Jamerson. And she's going to tell you a little bit about herself, about why she wanted to be a part of the Parent Partnership Board. And I'm going to turn it over to Sunny.
Unmute myself, but I'm happy to be here and be a part of this conversation. Just a little bit about me. My name is Sunny Jamerson. I currently work for Catalyst Behavioral Services as an admission coordinator for one of our residential facilities. I've been working there for a little over 5 years. I've been very fortunate to learn a lot from the leadership that runs that organization. I also serve as the current chair of the Substance Abuse Prevention Alliance, where we do a lot of community-based training on Narcan, delivering that to the community and teaching them how to use it, and satisfying some prevention efforts in regards to opiate use and overdose deaths. Of course, I am a member of OCCY's Parent Partnership Board. I'm also a full-time student. I am rounding out my master's degree in clinical counseling, and I'm a single mom of a beautiful 13-year-old little girl. And I think one of the most important things about me is that I am a Remerge graduate. I graduated from Remerge in 2014. My current sobriety date is October 10, 2011. So I've been clean and sober for a little over 10 years. If you know anything about Remerge, they are a community nonprofit program that serves women and children to keep them from being incarcerated and being separated from their kids. So at a time where I was at my lowest, I was offered an exceptional opportunity to participate in that program and have graduated and have just been living my life ever since then. Next slide, please. So why I became an OCC parent partner, because somewhere along the line, I figured out that I had a little desire, I won't say little, but a major desire to become an advocate for my community. We are taught in recovery to give back and give back what was given to us. And so I have navigated the world in the last 10 years with that aspect of trying to give back to my community. And the best way I can do that is as an everyday advocate. I advocate for the parents and children and the youth of Oklahoma. I advocate for the need of parent voice when decisions are being made, because it's extremely important to have that perspective. I advocate for better programming, policies, and funding for families and children. I advocate for parents like me who don't want to just get by, but want to thrive for their families as well. I advocate for the parent who falls through the cracks, those where services are missing access, limited access, those in rural counties. For the parent who cannot access stories or resources, which is an important part of my advocacy based on my personal experience. I've got a little sister who I love to death. We're 9.5 years apart, and she has a special needs son. And just over the last 6 or so years, I've been side by side with her trying to navigate this world of special needs services and the difficulties that she's had and the frustrations she has had and the limited opportunities that my nephew has had to get well. And so I advocate for parents like her who are in need of services and cannot access them. And then lastly, I advocate for every parent who have struggled with the questions, am I doing this right? Will my child be okay? Because I know I'm not the only one who has had these questions when it comes to raising kids. And it's not always easy to be a parent. And so, I advocate for those parents who need just a little bit of support, a little bit of confidence, confirmation that they're doing okay, and just, a little guidance sometimes. Next slide, please. So why be a parent partner, and what my experience has been in being a parent just, over the last 13 years. I say often to my friends and to the clients that I work with that parenting and recovery has been the hardest thing I've ever had to do. In addition to dealing with the things that go along with being a parent in recovery, like guilt and shame and fear, there is another aspect of parenting in recovery that is not often talked about. And, I wanted to be here today and present my story on what it's been like to be that parent in recovery and, feel kind of lost in trying to navigate what that looks like when sources are limited. There's not a lot of support for us. I graduated from Remerge. I had all of the services that I needed at the time. But when I got out of the program, and even though I've been successful since then, there's been a little limited support of where I could gravitate to. Fortunately, Remerge has got a aftercare or continuing care program that I stay very connected to. It's almost a joke. I've been going since 2014. We call ourselves the OG of the recovery of the RCC organization, but I'm grateful that they have that aftercare program for the graduates so that they can still stay connected. But there's needs to be more. I worked alongside a lot of other organizations who also have programs similar to this. And, just the need for the additional services beyond graduation would be very, very helpful. Another thing that I've experienced is that our state tends to have reactionary services. Parents need access to services all the time, not just when they're in crisis. And, the last thing that I want to do, this is what I've been taught to do in my recovery, is prevent crisis. And so, with me not having a manual of how to navigate this world with my teenager, I need help in trying to address issues before they become a crisis issue. Another thing that I've experienced is the unfortunate byproduct of labels and identifiers. They prevent me from accessing resources. I've built up my life. I've got a pretty successful life. I got a career that I love, got benefits that I pay for. But because of my financial standing, I'm often left out of the needed services that are provided to those who are of less financial standing, I guess you would say. Your need and access to services should not be determined by your income. And we're experiencing that right now with my little kiddo and trying to find her counseling services that our insurances will pay for. We all know behavioral health coverage is not the same as dental and medical coverages when you have private insurance. And so those deductibles and those copays can be astronomical, which limit our ability to continue services. Fortunately for my little kiddo, she has found her way in a really good school district who has provided in-house group counseling for their students. And I'm very, very grateful for that, because that is the place that she spends the majority of her time. That is the place where she experiences the majority of her developmental issues. It takes a village. And so I rely heavily on, the school systems to help in areas where I may fall short or may not have the knowledge in. It's the most important system in her life outside of her family system. And so not all public school systems have these opportunities for kids. I was over the moon when she brought home the paperwork to sign her up for that. But even in her school system, that opportunity is limited. And then it's only given to her for 3 terms, but there's more than just 3 terms of issues that she might experience as she navigates this world of adolescence. I've noticed a lot, work and personally, that everything seems to be done in silos. There's very little collaboration, and I'm really excited to be on this call just because of the multitude of people who come from different areas of expertise when it comes to families and children. But I would love to see more collaboration, not repetitive services, but more people working together for the benefit of all families and children, instead of working in their own little niches to get those things. I was really excited to hear Secretary Brown's information on prevention efforts and their their journey and what their plan is for that, because that is something that is very important to me as a parent. I find that there is not a whole lot of support for my kid at the systems level, especially in school. Things are not talked about that should be talked about, like normal development of conflicts not being normalized inside of the school system. These are preventative measures for our kids. And so to see that there is a plan to increase the prevention efforts makes me very excited. Because again, I don't want to be the parent in crisis. I'm trying to prevent crisis from happening. I feel that we miss out on a lot of opportunities within our school systems. We've got amazing teachers and educators out there who help ensure that our little humans are, physically and emotionally healthy. And I'm super grateful for that, but they need help in addition to the help that parents need as well, to ensure that our next generation are raised well and that they have, proper emotional well-being. We're reactive instead of proactive, and we micromanage and silo prevention efforts right now, which I find not to be very helpful in the situations that are facing my family. So what is my critical mission statement here? Sometimes I feel like someone decided that once people like me, a Emerge graduate, a parent in recovery, got the treatment that they need, they got successful, they became productive members of society, that we wouldn't need any more assistance after that. And I'm here to tell you that that's not the case. The greater statement is I feel that we have a bad habit of assuming that parents should just know how to parent. And that's not the case. The reality is that parents learn to parent from their own parents and caregivers. But what if those parents and caregivers were not positive role models or were disadvantaged due to negative intergenerational cycles? So we cannot assume that parents should just know how to deal with these issues that have been faced in my own family, and that services should not be offered to them. So the truth is that we are all out here just winging it, and we all need some help sometimes. And it shouldn't matter what your financial situation looks like on whether or not you're going to be able to receive services. And that's kind of how our systems are set up. We all need help not because we're in crisis, but to prevent crisis, or because we are never taught and no one ever teaches us. Parenting and recovery, like I said, is the hardest thing I've ever had to do, because my main resource for parenting knowledge and strategies are my own parents. I had really good parents. I was raised well, but they've never been a parent in recovery. And so it's hard for me to turn to them for advice and strategies to navigate, 2022 with a 13-year-old, when there's this extra layer of recovery that I also deal with on a day-to-day basis. So sometimes I need help. Sometimes my daughter needs help, but our systems and labels have made it hard for parents like me to find and get that help. And that's all I have for you guys today. Thank you.
Thank you so much, Sunny. We appreciate you sharing your story, and we're super excited about the opportunity to work with you. And again, great things from Sunny and our other parents that are part of our parent partnership board. So thank you for sharing your story. So we're going to switch gears a little bit, and we're going to continue to talk about partnerships. So, really, this morning's event is all about collaboration and partnerships, and some of the best programs are facilitated by partnerships. And so we wanted to have an opportunity to share with you an example of one partnership between the Commission on Children and Youth and Partnership for School Readiness that promotes parent voice. And I'm going to turn it over to Taylor, and she's going to tell you a little bit about OPSR if you're not familiar with that organization, and then tell you a little bit about the specific partnership between both of our organizations.
Yeah, thanks, Danielle. Hi, everybody. I'm Taylor Kneeisen. I am over at OPSR, and I just kind of wanted to, sorry, our printer's going off behind me. I just want to tell you a little bit about our organization and how we have been able to partner with the OCCY Parent Partnership Board to be able to really pull in that parent voice and kind of get that out into other organizations around the state of Oklahoma. So we were established in 2002, and our mission and our vision are both really focused on just making sure that kids are ready to become students and ready to become active learners and are prepared both mentally, physically, and holistic health-wise ready for school. So they have the resources that they need. We convene organizations and programs together to improve health services, high quality early childcare and learning opportunities and support services for families and parents. And like Sunny was talking about, there are a lot of just silos of people working on the same things individually. We want to make sure that we can get all of those people working on things together so we can really make more of an impact in the state of Oklahoma for our kids in early childhood. So through consistent and collaborative planning, we're making sure that we can make the best environment and learning opportunities for children of the age 5 and under. Next slide, please. So a couple of our programs that we are currently working on and have worked on in the past, we coordinate the Early Childhood State Advisory Councils for the state of Oklahoma. We have worked with the Project Hope, Alliance for Early Success, so 2 national partners, as well as Pyramid Model. We're still working with them continuously for the Pyramid Model to be implemented into early child care centers in the state of Oklahoma. And like Secretary Brown said, we are the entity for the Clearinghouse for Early Childhood Success, which has been very exciting. And we are proud and happy to give any information if anybody has any questions regarding submissions and proposals to get things funded for early childhood. Next slide. So how and why we are partnering with the partnership board is to collaborate and get that parent voice involved in the work that we're doing, but not only in what we're working on, but how we can get parent voice involved in other organizations and agencies. We have a standing line item on our partnership for OPSR's partnership board, so the public board for our organization. We have a standing line item for the parent partnership board to come in and kind of give an update on what they're doing. And the response we got was incredible about individuals from our board wanting to use these parents in their boards and to be able to inform work that they're doing to keep always making sure that parent voice is heard. We are collaborating with OCCY to connect to other agencies, and we are helping provide some funding to reduce the financial barriers so parents are able to physically serve on the board. So OPSR is really excited in our partnership and how we've established it and to grow it further on and encourage other people to get included and involved with organizations and parent voice. So that's all I've got for OPSR. If anyone has any questions, my email is going to be at the end of the slide from OPSR side. I am happy to answer those individually.
Thank you so much, Taylor. We appreciate you sharing a little bit about that partnership. Again, this is just one of many partnerships where you'll see interagency collaboration, working together to engage parents and promote family voice. You're going to hear a little bit later on in this morning's meeting from CSAW, the Children's State Advisory Group, that also has a parent component as part of that effort. And OCCY is a proud partner of CSAW. And so it's just really neat to see all of these agencies working together, both public and private agencies, partners working together to promote parent voice and engage families in program services and decision making. So we're excited about this partnership and other partnerships that we're engaged in. All right, so another great partner that is an amazing resource for all things related to parent partnerships is the Children's Trust Fund Alliance. And the Children's Trust Fund Alliance has been a consultant to OCCY for about the last year and a half to help us organize and develop our parent partnership board. And I can't say, they're just absolutely wonderful. And so I felt like it was really necessary for them to be part of this presentation because they are an amazing resource to anyone that is looking at engaging parents in their communities or within their organizations. So I'm going to turn it over to Kara Georgi with the Alliance, and she is going to take it from here.
Thank you so much, Danielle, and good morning, everyone. I just want to take a moment and let the presentation soak in. You all have heard a lot of information this morning, and I don't know about you, but when Sunny was sharing, I was getting goosebumps of like, this is what the magic is when parents share. And I also was really getting moved by emotion. And so knowing that you have a really long meeting today, I'd like to just take a moment, encourage you to, if your camera's on, you can turn it off or you can keep it on. Just take a moment wherever you are, if you're in your office, you're at home, wherever you're working and joining us from today, to just truly stand up. And the reason I'm asking you to stand up and take that time is because the reason each and every one of you are joining today is because you're standing up for Oklahoma's children. You're standing up and you're saying, we are going to show up strong as partners, as collaborators to figure out how we're going to make a difference for families in Oklahoma. And I want you to just take a moment, reach up, think about all the opportunities that are ahead of you in Oklahoma. Think about your own work that you're doing on a day-to-day basis. Think about the interactions that you have on a day-to-day basis, whether they're work or personal. And I encourage you then to sit back down. I encourage you to check out the Jamboard because I already see some of you have been doing that. I'm going to drop it in the chat again. And I want you to just think about what can you do? The reason I share that is because, as Danielle said, I work for the Children's Trust Fund Alliance as the Alliance National Parent Partnership Associate. I myself am a parent, and I'm actually joining you from New York State. And I came to the Children's Trust Fund Alliance through the council that Betty now co-chairs, the Alliance National Parent Partnership Council. And when I joined it and I started the parent journey, I had no idea what I was getting into, especially with the relationship with the Children's Trust Fund Alliance. But what I have learned is that while this is a membership organization for states' children's trust funds across the country, that this is also truly a hub of great information about prevention and what prevention really means in the everyday lives of children and families. What it means for having good quality resources that organizational partners and others who are doing this great work in the community have available to them that they can use. It's also the really key piece about really truly partnering with parents. As Danielle said, when the Children's Trust Fund Alliance came to Oklahoma to start this work, right from the beginning, we had an advisory committee helping with this. We had parents involved from the very beginning in every part of the process of building the Parent Partnership Board. In addition, what I think is really critical for our organization is that we have a curriculum called Bringing the Protective Factors to Life in Your Work. And when I first came to protective factors as a parent, I knew they were important. The community people told me they were important as a parent, but I didn't really understand what did it mean for me as a mom? What did it mean in my everyday parenting moments? Being able to go through the online course that's free, that you can get CEUs for, and then being able to go through the in-person training provided me an opportunity to really truly understand what protective factors mean in action in my everyday parenting moments. So that way I can celebrate them on the good parenting days, the days that Sunny talked about, where parents just, to be honest, need concrete support then, not later. Those moments when parents have to go through really hard times because that's the reality of life and we have to build our resilience, being able to recognize that and celebrate that. And so while I'm here today representing this organization, to me, this is so much more than an organization. It's so much more than just checking out our website. And we'll get that link dropped in the chat for you of where you can find tons of amazing resources that are available for you. Some of the things that the Alliance offers in terms of technical assistance is we help build parent advisory groups or parent partnership boards. One of the things that we have learned is that it's not a one-size-fits-all approach for this type of work. It's about truly coming in to know the community, the state, the systems, the structures, that are already in place, and not coming in to redo it all, but coming in and say, how do we bring you all together? How do we partner? How do we build this so it's effective, it's long lasting, and there's sustainability? In addition, we've learned that parent networks are important because you need to be able to have opportunities to connect with parents in different ways. One of those for the Alliance is the Alliance National Parent Partnership Council, where we're able to have parents help advise the work that the Alliance does. There's a couple other parent networks that we have that I'll be talking about shortly. One of the key things that's important as you're thinking about partnering with parents is having an opportunity to do a strategic sharing training. What that means is it's more than just, hey, Sunny, can you come tell your story? No, to be honest, you all, Sunny spent a lot of time prepping, getting ready for how will she pick, what does she share with you today? How will she weave in her key points, her message, her hopes that she wants you to take away for Oklahoma? That's strategic sharing. It's not just parents telling the story from the moment their child was born until present day. It's figuring out how to elevate key points. It's learning about how to understand who's in your audience. It's about learning how to understand, tying in facts and data that you all have. And that's why the partnership board for the commissioners is so critical, because that board will hear great information like from Taylor and others, and then be able to use that as they talk about their experiences to really truly make a difference. Another resource that we have that is new and hot off the press and just released is a book club guide. We had the opportunity to work with one of our parent advisory groups and explored the book, What Happened to You by Oprah and Bruce Perry. In that book, it talks about trauma, talks about ACEs, resiliency. And we had the opportunity to go through that book and create a book club guide for parents to really look at how do we look at how we were raised, like Sunny said, and see how is that showing up in our everyday parenting moments? Is that the way we want to show up? Or how do we change things for the generations to come? That book club guide, it walks you through chapter by chapter. There's questions, there's journal pages, there's coloring pages. But I think what's the biggest piece with that to share is that since doing it, we started on a dream of what would this look like? How could we do it? Would we ever meet Oprah? We did, you all. It was amazing. She came for our final night of book club and was able to hear from the parents about the impact of being able to have a space like that where they could share. In addition, we have the opportunity where you can tell us if you're doing a book club in Oklahoma. And then we're going to bring those people together and have an opportunity to talk and share lessons learned and more. So I encourage you to check that out. In addition, the Alliance has explored different state parent fellowship projects where parents are able to learn about how laws and policies are passed and what that looks like, how they can get involved, how they can understand who the people are that they need to talk to when they want to see a policy change or when they want to be able to share with someone so they can be better informed as they're going about the work that they're doing in their everyday projects. In addition, we have a parent partner learning collaborative for states that are doing work where they have parent partners who are helping to do the work directly with parents. It's an amazing collaborative where it's a staff and it's also parent partners where they can learn and share from each other. Because one of the most important things we've learned is that people need space to share. So we're not always reinventing the wheel. And lastly, there's that online and in-person strengthening families training for the protective factors that I've mentioned that I think could be a real asset for all of you. But remember I said at the beginning that there's those parent networks. One of those is our Birth Parent National Network, or our BPNN. Every single one of you on the call today, it looks like there's 151 of you. If you are not already a member, truly you could sign up and become a member today. And you might say, Carol, why would I do that? Here's why. We have this network that is almost 500 members strong of birth parents and organizational partners coming together to talk about how do we improve practice for families, communities, and systems. We come at it from a strengths-based place. We really promote parents as leaders and strategic partners. It's a place where we can truly come together to learn great information and resources and bring that back down to our states and, more importantly, to our communities. We have quarterly webinars and an annual virtual convening. And this year, we're actually going to be moving our virtual convening to June. And it will be on the topic of anti-racism and the social ecology model. So I encourage you, if you are not connected, this is a great way to hear information. In addition, when COVID came, our Birth Parent National Network and our other parent groups asked to be able to come together regularly. And by becoming a member of the Birth Parent National Network, you will be invited to our weekly caring conversations that we host every Monday. It's a space where there aren't titles. It's basically like a big family that comes together, hears information and resources, and has the opportunity to connect and be strengthened. Lastly, I want to share about our birth and foster parent partnership. This started in 2016 and is a national movement of birth and foster parents and kinship providers coming to work together to figure out how do we transform the way that things are done? How do we improve outcomes for children and families? It's supported by our organization as well as the Youth Law Center's Quality Initiative and Casey Family Programs. What I think is the most valuable thing for you all to know about this network is they also have a free, great, amazing resource that you can download. The birth and foster parents work together to create a relationship building guide to walk birth and foster parents together of how they can work through the different stages of relationship, all the way from when the child is first removed, all the way till after reunification and the family is back together. In addition, there's a state and local leaders guide to talk about policy and practice foundation. And what I think is the best piece about this is they are doing webinars to walk through all stages of the parent partnership relationship guide. This next one in May, it's going to be all dads talking about building relationships. So many opportunities for you all. I hope that gave you a lot of inspiration. And my biggest hope and wish for all of you in Oklahoma is that you will keep as dedicated and strong to doing this amazing work for families as you have been while we've been working with Danielle and her team to help get the Parent Partnership Board going. And most importantly, I hope you all know that we are an email, call, or a registration link away to be able to continue giving you great information and resources and continue helping you build out the amazing work that you're doing for families in Oklahoma. Thank you for your commitment. I'll be dropping those links in the chat, and I encourage you keep adding to our Jam board. And it has just been an honor to be able to do this work in Oklahoma with all of you. So thank you.
Thank you so much, Kara. Again, the Alliance is just an absolutely amazing resource, and I encourage you to visit their website, connect with Kara and others at the Alliance. They've been so helpful in helping us plan our board, and even after the launch of the board, they have partnered with us to mentor us and to just be a great support to our work and to our parents, our actual members of the board. So thank you so much to the Alliance. All right, next slide, please. So we wanted to talk a little bit about OCCY and our support for parent leadership programs. And if you have a parent program, or if you are wanting to start a parent program, just know that we are here as a resource for your work and your efforts. We convene and coordinate public-private partnerships to support parent voice, and that could include leveraging resources for training, data collection, funding. We're here to pull people together and to build partnerships so that we're all impactful and effective in our work. We provide technical assistance and training for parent groups, and those coordinators are those professional staff that support those parent groups. Some of the resources that Kara talked about, some of the training resources, we'll be bringing those to Oklahoma. So be on the lookout for those opportunities if that's something that your parents or your staff are interested in participating in. We also want to help promote and help recruit parents for leadership opportunities at the local, state, and national level. We have already been contacted by several organizations throughout the state that are looking for parent leaders. And so we have begun to develop a pool of parents that have been vetted and that are looking for opportunities to serve their communities and to serve our state. We're happy to promote your parent programs as well through OCCY and through our partners. And then, of course, there's always opportunities at the national level. Again, Betty Hawkins Emery is a great example of somebody that has done great things here in Oklahoma, and because of her amazing leadership, she is now serving at a national level with the Alliance. OCCY can provide resources and materials to organizations and communities related to parent engagement. So, for example, if you're looking for evidence-based strategies for parent engagement, we have those resources available, and we're happy to sit down with you and talk through those resources and help guide your work. We also want to serve as a role model and as a mentor to other parent advisory groups and providers. Again, we're here to learn from each other and to encourage each other. So anything that we can do to, as we walk this journey, and really, I hope that, you know, a year from now, 2 years from now, that this isn't novel, that engaging parents is the norm, and that it just becomes an everyday thing to all of us. But we want to be a role model and serve as a mentor to others that are working toward parent engagement within their programs and their communities. Next slide, please. So what are some steps that you can take to help amplify parent voice in your community? We have a few bullets here, but there are many more. And hopefully you're going to share some of your ideas on the Jamboard. So please continue to visit that Jamboard and share with us what you have done in your communities to amplify parent voice. But some steps that you can take: ask your community, ask your parents what they need. And that looks different in every community, but it could include surveys, focus groups, stakeholder meetings. Could just include more informal, more organic, just conversations with parents and families. You can start a parent advisory council or a board in your community, or if you already have existing councils and board in your communities, which many of you do, probably everyone does, be sure to include parents and those with lived experience as part of those councils and those boards. Incorporate family engagement in your organizational policies and practices. Include those in your community charters. Include parents in planning and organizing. As Kara had mentioned, and I believe I mentioned at the beginning, when we began planning for our parent partnership board, we had parents part of that planning committee to help us guide the work, so that when we launched the board, it was truly informed by parents. So encourage you to include parents from day one in any planning and organizing that you're doing for parent engagement. Provide multiple levels of opportunity. For example, with time commitment. All of us have different schedules and unique situations, and most of us work a traditional 8 to 5 position, but that may not work for all parents. And so as you're thinking about engaging parents in your community, think about engaging them in the evenings or on the weekends or during the day. Think about engaging them in person or virtually. Just recognizing that everybody has a unique situation, and we want to try to connect as much as possible and provide those multiple levels of opportunity. We want to promote participation of all types of families, whether it's foster families, families that speak a language other than English, LGBTQA, rural versus remote, and many others. We want to try to be as inclusive as possible as we work to engage parents. And last but not least, reach out to OCCY, reach out to the Children's Trust Fund Alliance, and to our other partners that are on the call today. There are lots of groups that have been engaging parents for a very long time and have amazing expertise. Again, you're going to hear from other folks later on this morning that have great resources and connections and opportunities to help you be successful as you are working to engage parents with your organizations and communities. All right, next slide. Well, we have, and again, those were just a few examples, and hopefully you guys are visiting our Jamboard, and we have plenty of opportunities. So I'm very excited. We have lots of time that we can actually go and visit the Jamboard. So Kara, if you are able to actually pull up the Jamboard, and then those of you guys that are with us today, if you haven't posted on the Jamboard, we're going to give you a couple of minutes to do so. And then we're going to take a look at what some of the responses are from each one of you. Again, it's all about learning from each other and recognizing that we're on this journey together. All right, so Kara is pulling up the Jamboard. All right, so we're going to give everybody just a couple minutes since we have time to post on the Jamboard. And as we're doing that, let's see, I may need some reading glasses here. But the question is, where do you see parent voice should be amplified? What is one commitment you can make to make that happen? So I'm going to just randomly pull off some of the responses that our partners have posted. We have families who have had child welfare involvement should have a voice to share what types of resources and interventions could have or did support their family to reunify more quickly. They should be paid for. Thank you so much for posting that. Somebody said they love the book club idea. We'll be bringing that to Oklahoma, so be on the lookout for that. And Carrie, you might have to help me. I'm having trouble that the type is very, very small. If you can maybe pull out some of the comments. Parent voice and time are very valuable. All right, a post-it just went over what I was getting ready to say. So let me find another one. Somebody said, thank you to Sunny for sharing your experiences, your expertise, your views. You are spot on. Keep up the great work. This is where I believe the parent voice can be amplified, giving those parents a voice. And back to the post-it that I was reading, parent voice and times are very valuable and should be compensated in some manner so that they know they are valued. Very much agree. Thank you for that post.
And Danielle, this is Kara. We've had some about foster families have an office, but natural or birth families do not. Someone needs to be available, lead by a family member, not the agency, to accept the concerns of families as they walk through the systems that are serving them. Also, I saw some talking about families of children in the neonatal ICU, pediatric ICU, etc. need to have a voice in the way their children are served. There should be advisories at children's hospitals that are led or co-led by families. We also have some that talk about the incarceration, a lot that talk about the resources. And I just want to encourage you all, because I see more and more people joining. At the very top in the middle, you'll see where there's arrows and it says 1/6. If you click on the arrows, you'll see additional screens. So I'm going to flip over and see if anybody's on other pages. I know there was one that I saw that was asking about Spanish resources, and there are Spanish resources available on the Alliance's website. But feel free to use those arrows right at the top. You can keep those ideas coming. And if anyone has any difficulty with Jamboard for some reason, please feel free to drop your ideas in the chat and we can get them created on a post-it note on your behalf.
Well, thank you so much for these great ideas. And we're going to be sure to share this information back with our hosts, OSDH and OKDHS. And I believe they'll have an opportunity to share some of these ideas with everybody in attendance today. But we're going to leave this Jamboard open throughout the morning. So if you have an idea or something comes up, please feel free to just continue to post information on the Jamboard again. But it's all about engaging, partnering, and learning from each other. So we thank you for participating in the Jamboard. And Kara, if we can go back to our final slide. Thank you. So that concludes our presentation today. If you have any questions or if you are looking for additional information, our contact information is on this slide for all of the presenters. Again, if you are an organization or community that is interested in parent engagement, please feel free to contact the Commission on Children and Youth. We will be happy to support your work and your efforts. And we're excited to go along this journey with you. But again, I hope that when we meet again in 6 months or a year from now, that parent engagement is just the norm. But it takes time, it takes intentionality, and it takes dedication and effort. And I have no doubt that the folks that are on this virtual meeting this morning, you guys are just the folks to do it. So we appreciate the opportunity to present today. And I believe then I will turn it back over to our host.
Thank you, Danielle, and everyone for sharing today. It was great information. Now we're going to turn over to our directors of the Health Department in the Family and Support, as well as our Child Welfare Service Director, and they're going to provide some updates specific to the agencies and the plans that we have put forth and are working on, and then we'll move on to the next thing. So Lori, are you ready?
Yes, I am. Good morning, and thank you for attending our biannual collaborative. That was amazing from OCCY, and that's a kind of a little bit of a tough act to follow. Amazing work that's going on, and I love the parent voice. I'm excited to see all the work that has happened and will happen as we move forward, and it's much needed. And I know that we're going to see wonderful things out of this effort. So I hope everyone has been enjoying it. So this meeting so far, and I want to just tell you a little bit about myself. I know I'm new to many of you. So again, I'm Lori Essery, and I replaced Beth Martin. She's familiar, you're familiar with that name. She served OSDH for many, many years, did an amazing job, but I took over Beth's position in December. And so it's been, I can't tell you how amazing it's been just the few months that I have been here. I stepped into an amazing situation with a great team, and I'm enjoying every bit of it. Meetings like this and this collaboration, I love this work, and it's what we're really all about. But I do want to tell you a little bit about myself. As like I said, I'm new to many of you, but I have worked in prevention and public health for the past 16 years. I began my career in East Texas, and I worked in substance abuse prevention. I was the regional program manager, and I covered 23 counties in East Texas. I did a lot of traveling and a lot of work in that area. And I worked also with the DEA in child endangerment. And that was an amazing experience, tough, but I learned a lot and really developed a passion and heart for prevention and for protecting our families and children. So I spent several years there, and then I had an opportunity to move back to my native Oklahoma. And I am a native Oklahoman. I was born and raised in Adair County, Stillwell, little town in Stillwell. Some of you may know it. It's a small place, but a really lovely place in the hills, and most of my family still resides there. And so I moved back to Oklahoma to be just a little bit closer to family, and I took a position with the Oklahoma City County Health Department and spent the last 10 years there prior to coming to OSDH. I wore a lot of hats at Oklahoma City County, but I primarily served as the operation manager for community and population health. And as I said, the transition to OSDH has just been amazing. And I love my team, and I love all of our partners that we've had the opportunity to work with. So I'm going to just transition a little bit and talk about the state plan. We are in very early stages of the state plan. So we have a lot of work still yet to do. So we're kind of gathering doing a little bit of strategic planning, and we will be involving our partners as we move forward. We'll have more to offer you in our October meeting, but do know that we are in this planning stages. One of the things that we definitely want to do with the new state plan is be more intentional. We want to be very strategic as we move forward with the state plan, and look at how we can really develop very clear, very achievable objectives. And so we can measure and evaluate that work we're doing in child abuse prevention and neglect. You know, it's very important that we see that our work is yielding results. And so, as I shared, I'll have more for you in our next meeting, but we're excited about working on that plan and getting started. And we will be collaborating with many of our other partners. And we also will be involving the community, because that's so important that we have that community voice to speak into the plan. A little bit more of the work that's going on here at OSDH right now. It's kind of grant application and renewal season for us. We're very busy applying or renewing many of our grants that support the services that we have here that support families. We also just received a new McVie Innovation Grant we're very excited about. And this grant is really designed to support the development, implementation, and evaluation efforts to improve our home visiting model. So we're really excited. We love home visiting. It's so much a part of what we do in our prevention efforts. And we are very excited that we have that opportunity to work more and improve those services. We're also looking at the services we have statewide and how we can better extend and expand those services in an efficient and effective manner. We know that we do have gaps that exist. We serve the entire state of Oklahoma, but as you know, the geography of Oklahoma is a little bit diverse and can be challenging at times, especially in our rural and frontier areas. So we really want to make sure that we are serving all the families across the state of Oklahoma, and that's very important to us. So we're very excited about that opportunity, and we believe that we're going to be able to offer more services and really meet the needs of our families. We're also in the process of recruiting, hiring, and training some new workforce. Unfortunately, and I'm sure many of you experienced, the pandemic had an impact on all of us, and we did lose some personnel. We have great personnel here, and many people charged forward during the pandemic, but it was a difficult time. And so we are regrouping a little bit, but we're hiring, we're rebuilding our staff. They're getting great training, and we're getting our caseload back up, and we're very excited. We're just, as I said, we're looking at ways we can expand services, regroup, and move forward to better serve Oklahoma families. So I'm very excited about the work we're doing here. And I also want to mention that we're in a strategic planning phase with our agency as a whole. We're in a transformation process. And one of the things that we have created and we've made our flagship issue is our ACEs, adverse childhood experiences. And as an agency, we are completely committed to that mission, and not just those that are working in that field, but all employees at OSDH right now are learning about this very important issue, why it is so important, how it affects children and then into adulthood and families moving forward. So we're rallying around that issue as an agency, and we believe that we're going to make strides in that area, and we're very excited about that. I really believe in the work of public health and prevention. I love prevention. I have a prevention heart. It really is my passion. And I love that I get to work in this field and do so much prevention. Secretary Brown referenced a great deal of prevention about serving families. We're serving families early on. We do meet families where they are, but if we can really begin at the beginning, we can set families on a trajectory towards success. And that's what we want to do. But again, we want to support them in all stages. And we couldn't do that. Again, referencing Secretary Brown, we couldn't do that without our partners, without our collaboration. Like our great partner today, DSH and OCCY, you're going to hear DMH and talking about thriving communities today. All of the work that all of you are doing, all of our partners, that is what makes the difference. We cannot do this alone. It takes all of us in this effort to really make an impact. And I love, again, that we're collaborating today. Sunny referenced it. What an amazing, I'm going to call it a testimony, amazing testimony to her strength and endurance. And she is right. Collaboration is so important. We can't be siloed. We all need to work together in our efforts to prevent child abuse and neglect. And we talk about child abuse and neglect, which it is a reality. It is true. It exists. But I think what we're doing today is not just focusing on that, but focusing on strengthening and supporting families, that we're insulating families. We're flipping the script a little bit. And, you know, we're saying that that is what we want to do. We want to strengthen and support these families. We want to wrap around them. We want to insulate them and provide them the resources they need to exceed. And we are seeing that. We are seeing many families that are supported, that are receiving that continuum of care, but we just want to do it a little bit bigger and a little bit better. But we're working on it. We're working on filling gaps. And again, thanks to so many great partnerships that we have in the state of Oklahoma. And that includes you at your local levels. We could not do this work without you. You are invaluable. And so again, thank you for attending today, all that you do in this effort. And again, I thank our partners. I referenced Child Abuse Prevention Month a little bit at the beginning, but I am wearing my blue today, as you can see. And I see on the cameras that several of you are as well. And we have a lot of activities coming up in the month of April. You can participate in many ways, and some of those will be shared. But, and actually my colleague, Dr. Deborah Shropshire, will share in just a moment, and she'll talk about the great work they're doing in DHS, and she'll go into more of the activities and events we have planned for Child Abuse Prevention Month. So again, thank you for attending today. I appreciate all the work that all of you are doing. I look forward to working with you more as we move forward. And so you guys have a great rest of your day and enjoy the rest of the meeting. Thank you so much.
Hey, good morning to everybody. This is Deb Shropshire with Child Welfare. I have got my blue on. I've got about 3 different shades of blue, I think, going on, but it is so good to see all of you and the different versions of all of us coming together. And I think it's a great day to not only be together, but also to kick off Child Abuse Prevention Month. This group, the group that was kind of planning this meeting, we've had a number of conversations really over the last year or two even about wanting to just change the name and get away from child abuse prevention, as Lori was talking about, toward family strengthening. And how do we work together to do family strengthening? And could not be more excited for the work that's being done, really, I think, across our state. And it seems to have a lot of momentum over the last 2 or 3 years, especially around, even with all the challenges of COVID, around family strengthening. So it's a good day for us to be together. It's good to see all of you. I wanted to touch on something that has been talked about a little bit around sort of parent voice and the excellent group that we just heard from, and let you know that actually with the Department of Human Services and specifically I'm thinking about Child Welfare Services, we've definitely taken some steps over the last 2 or 3 years to do a better job of listening to the voice of the people we serve. Director Brown challenged us on that when he almost immediately after he arrived at the Department of Human Services. We had always historically had some youth voice involved in our decisions, policy, practice, et cetera, but not really parents. And honestly, I ran into that whenever COVID happened, and I could communicate. I mean, I'm a pediatrician, and so I was trying to communicate guidance on COVID and health, and not just health, but also why some of the decisions were being made about visits in person or virtual or all those things. I was communicating that to foster parents. I was communicating with judges, with providers, and the group of people that I found early in those days of COVID. You remember back in those early days when we just every day was like a whole new set of information. I couldn't communicate with parents. We didn't have very good mechanisms in place to be able to even send out an email to all the parents that we interact with in child welfare. And so we began actually during that time just a much more intentional effort to have the ability to communicate broadly with parents. Also began putting together our team started putting together a parent newsletter that was for national parents who were engaged with the child welfare system and trying to communicate just information or to get feedback from those families. And then that has evolved now into some surveying related to parents as they are served by the child welfare system. And we definitely have some next steps on the horizon around how to more formally engage parents in the process of planning and building services and things like that. So we have got a ton of I would say, momentum around that, and super excited about what's happening in other agencies and the ability to tag up together in a learning collaborative in some environments like that where we can actually learn from each other and kind of work together. So that was a super great topic. I'm glad that that all of us sort of got to enjoy that today. I'm going to give you a couple of quick updates on child welfare, and then we're going to turn to another really exciting topic around the way sort of communities are coming together to imagine, again, strengthening families. So on the child welfare side, besides some of the parent updates, you guys may remember, some of you who were on the last call, that in October we were just beginning to launch our Family First Prevention Services Act plan. This is federal legislation that directs child welfare to begin to imagine how to move dollars toward prevention services as opposed to just treatment, kind of later down the road treatment services. Now, just for clarity, prevention for child welfare is often prevention of foster care. So it's really tertiary prevention. We have, as an agency and as a division, worked really hard to try to move into the secondary prevention space and hold hands and partner with our friends at Health Department and others to kind of build really a full prevention continuum or a full family strengthening continuum. But when you hear Family First Prevention Services Act, that's really close to child welfare. That's really up close to foster care. And so just know that that's kind of the space that we're building in. We launched our first plan. So the first plan was approved, started in October. And I say first plan because the truth of the matter is this thing is going to evolve over the next number of years until our state actually has for that sort of tertiary prevention what it needs. Included in that first plan were some specific services that were that fit within the federal approvals. And we're really pleased that some of those services have actually, in the last 6 months, actually seen higher ratings on the federal clearinghouse than originally we thought they would. So that's fantastic. So there's a lot going really, really good with that plan. The plan primarily aims at providing services around parenting and around parental mental health treatment and around parental substance use. And so partnership with the Department of Mental Health as well as with the Healthcare Authority is a super important piece of really having a strong functional family first plan. And so we have taken on a number of different kind of projects and partnerships with the Department of Mental Health and others to try to really address parental mental health and substance use and make sure that families that run into child welfare are actually getting to the right kinds of services to meet their needs. We tend to focus on safety. I mean, that's sort of our mandate, right? So like child safety is the thing that child welfare pays attention to. Child safety always sits within the context of a much broader situation that's happening in a family. And whether there's mental health or substance use or poverty or other kinds of concrete needs that a family has, if we are only looking at a family through the lens of is your child safe or not, and we are failing to look at all those other structural elements of a family and to have good partners that we can connect families with, then we're not doing our job. And so I would say the strength of some of these partnerships and the ability to actually look at a family and see them more holistically is growing in child welfare. It's not perfect, but it's growing. Another place that we have been sort of growing partnership is with our own other divisions within our own agency. And so Adult and Family Services division within the Department of Human Services hosts our safety net programs, things like SNAP and TANF and other kinds of safety net programs. And again, those concrete supports around families are a key piece of child abuse prevention or family strengthening. And so a lot of work going into that. I'll mention that I know I saw Deb Smith on this call, and I'll mention Deb Smith is the director for Adult and Family Services in DHS. She was formerly the director of child welfare. So has this incredible, I bet you there's no state in the country that actually has a person with the breadth of sort of knowledge of what the end result is of not strengthening families is in child welfare, but still has the opportunity now to lead upstream in terms of some of those concrete supports. And so Keitha Wilson from my shop, who's handling our kind of family first plan, and Deb, and I think we have a couple of other partners from the mental health space, will be part of a presentation at the CCAN conference that's happening later this month, talking about some of that kind of upstream work. So if you happen to be going to the CCAN conference, you can keep an eye out for that breakout if you want to know more about some of the things that we're doing to work together around prevention. I'll just also mention that you heard the health department and Lori talk about their state plan. We have state plans as well, and not just the family first plan. We have a broader what's called the Child and Family Services Plan, which really all these plans are is a way that we tell the federal government how we're going to spend the money that we get from them within the federal guidance that we have. And so we will also be over the next year to 2 years going through a period of review of kind of quality improvement or looking at our data in a specific way, working with stakeholders to continue gathering information about how our system is operating, and then evaluating, in a sense, our child welfare system and imagining what it should look like over the next 1 to 2 to 5 years. And that definitely, that whole process of assessing where we are and also building our next state plan does absolutely need the voices of those we serve. So I'm glad we have parent youth voice kind of on the table, as well as many of you who are out in communities doing this work. And so we'll be reaching out over the next 6, 12, 18 months for assistance with, talking through kind of what you see the needs are. So look for that. So the last thing I'll mention, and this is kind of a segue into the next segment of our meeting today, is for the last 2+ years, I think it was, and Brett Hayes, I know you're on here, I think it was January of 2020, right before COVID, that I wound up in the room with a bunch of other kind of division leaders, apartment leaders, et cetera, on the CSAW committee meeting. And there was kind of some visioning going on about what could CSAW, which is the Children's State Advisory Work Group, this collection of people from multiple agencies, what could we do if we sort of got together, had a common agenda, common goals, et cetera. I feel like we talk about that a lot. We talk about partnership. We do a lot of partnership, but I think this was a fresh visioning session around how we could leverage each of our divisions and departments to sort of work collectively. And that group has continued to move forward hard throughout COVID to develop some really specific goals and really specific work around how to work with communities to strengthen families. That committee kind of wound up merging with or working with a number of other efforts that were going on in the state, including the Trauma Informed Care Task Force, and including something called Thriving Families Safer Children, which was sort of a child abuse prevention effort aimed at child welfare agencies, but also in partnership with other agencies that are responsible for abuse prevention. And so all of those efforts seem to be really starting to come together with the Children's State Advisory Work Group kind of taking a lead role in that. But the work group has also really morphed and kind of evolved a little bit as well. And so I am super excited to have Brett and Janelle, and I know you guys have some other folks with you as well today, to talk, Tavon, I'm not sure who else you've got on your team that's going to speak to us today, but to talk about the work of the Children's State Advisory work group, and specifically some of the work I think around thriving families and safer children. And so I'm going to turn it over to you guys.
Thank you so much, Dr. Shropshire. Good morning, everyone. Let me get my screen shared. Can everybody see that for the most part? Yeah, great. Well, again, good morning, and thank you all, Dr. Shropshire, Lori, Keitha. You guys always put on a great show. Sherry, a lot of great information here today. Before we get started, I do want to do introductions of the team who is presenting. So I'm Brett Hayes. I'm the Director of Hope Transformation for DHS, and get to co-chair CCY with my great friend, Janelle. Janelle, do you want to tell us a little bit about you? Janelle, you're on mute, my friend.
Sorry, friend. Janelle Breton, thank you. Janelle Breton, I'm the Director of Strategic Planning and Engagement with the Office of Juvenile Affairs.
Thanks, Janelle. One thing that I did want to talk about real quick before I introduce the next two is CCY has really evolved, as Dr. Shropshire mentioned, and we're super excited about our partnership with the Health Department and OCCY, who is currently supporting the role of Tavon, who's our cross-system coordinator. As we go into the next year, DHS and Health Department will support the role, and we as a CCY team are looking at every year of how do we continue to support this needed position to really provide this cross-system coordination to really support children and families. So Tavon, do you want to tell us who you are?
Yes, thanks, Brett and Janelle. My name is Tavon Lewis. I am a cross-systems coordinator with OSU, and I'm excited to be here and transition into this position. And yeah, can't wait to talk about thriving families, safer children.
Thanks, Tavon. And last is we're super excited about Renata, who has joined us from really Podo, who is an individual with lived experience, but wears many hats. And today she gets to wear all of those hats. But as was mentioned earlier, we have evolved as a group, and we do now have parent representation, along with we've added a few new members, Deb Smith being one who is over Adult and Family Services, the Safety Net program, to really help support the continuum. So with that, Renata.
Thanks, Brett. Good morning, everybody. Like I said, my name is Renata Goolsby, and I do live in LaFleur County, Southeast Oklahoma. I'm very honored and blessed to be here today with you guys. Like you said, I am a mom with lived experience, and I do wear many hats. So I will tell you guys, if you saw earlier, I had put in that I'm the chairman of the Oklahoma Family Wave, and that was a peer and colleague elected position. And that group is other caregivers, family support providers, and family advocates with lived experience that share a mission to support and empower families by giving them hope and using resources and our shared lived experiences, and encouraging family voice and choice. I'm also on the state advisory team as the state family support provider representative, and also a member of the CCY. And that's where I first heard about the Thriving Family Safer Children that we're going to talk about.
Thanks, Renata. So with that, Children's State Advisory Work Group, we over the last year have done several things. And I believe last time we were here, we presented over our 3 goals that we came to fruition through the retreat that we had back in June of 2021. And when we went through this retreat and thinking through where we really wanted to head, there was 3 goals that really came up. Is one, as we know, as Dr. Hellman and the Hope work was coming to Oklahoma, we really wanted to look at how could we really truly leverage Dr. Hellman in a way that we could infuse hope into every state organization. And really partner with the First Lady and the governor's initiative around building a hope-centered state. So we really began to explore that goal. And as you've heard a lot around ACEs and hope, what we're super excited to announce is that we were able to pull that off. And currently we have worked in 30 organizations over this last year, and we have really trained 358 executive leaders with the Hope Science. And so we're super excited about that as we move into year 2. The second goal that you guys see here is really around the trauma-informed task force that sunset recently. And what we wanted to do was really keep that work alive. And so Janelle and Tavon have really done a great job of creating a work group around this to move the work forward. And one thing that they're really working hard right now on is a website. How do we begin to coordinate all of this work in one space? And so that was one of the goals of the Trauma-Informed Care Task Force, is how can we do that work? And then the third goal, when we really worked together, was around community investment. And something that came up all the time was, man, we always write for these grants, but by the time we get done writing the grant, we haven't included the community. How do we come together as a team, the CSOL team, and really let's look at what we have and how do we bring the communities in to help support this work? And so that's what we coined as community investment. Well, that day, as we were sitting there, Dr. Shropshire and Jamie Ledoux, who were working on Thriving Families, Safer Children, said, man, this sounds really familiar to what we're doing. And so we came together with the Thriving Families, Safer Children team and the CSOL team and said, hey, it looks like what you're wanting to do within this goal is really the same here. So how do we begin to merge? How do we begin to do that? And so we had several meetings about that, and the best fit was for it to really come underneath CSOL so that we could really support the implementation of this work. And as I'm about to turn it over to Janelle, who will really talk about how we identified the communities and what that looked like. And then Tavon is going to really dive into what Thriving Families, Safer Children is. So with that, CSOL is working with 3 goals, really the infusion of hope across the state of Oklahoma into different organizations. The Trauma-Informed Task Force, with the work that's going on there, is how do we continue to move that work forward? And then lastly, Thriving Families, Safer Children. Janelle?
Thank you, Brett. Not sure if my camera's coming up. Apologies if it's not. So just talking about what is Thriving Families, Safer Children. Just share a little bit about that. It's a national commitment to well-being. It's a national initiative with national partners working together with parents, youth, and community organizations. And this is in partnership across the public, private, and philanthropic sectors. It's really important, creating a more equitable child and family well-being system to benefit all children and families with the goal of breaking harmful intergenerational cycles of trauma and poverty. So I wanted to share some history looking at this slide on how the Thriving Families, Safer Children began in Oklahoma. So back in December 2020, a group of committed change agents came together to apply for participation in Thriving Families, Safer Children, a learning collaborative. Oh, sorry, Brett, we're still on the other slide, I think. Yeah. The application highlighted numerous current historical efforts of Oklahoma's vision to reduce or eliminate the amount of trauma experienced by individuals, heal and strengthen families and communities, and build alternative support so that foster care is no longer an intervention for child safety and well-being. So as a result, Oklahoma is one of 11 states selected to receive technical assistance and other supports. And looking at the vision of CSOL, the Thriving Families, Safer Children Steering Committee identified CSOL as a critical working group to execute those shared strategies as Brett shared earlier. And just partnering with leadership, supporting the top levels of each of the organizations, that cleared a path for these groups to work together through shared vision and values to develop the strategic initiative that's going to support the local communities that have been identified. And let's go ahead and go to the next one, Brett. So this is a brochure that was developed to introduce Thriving Families, Safer Children to the communities that were identified to begin this important work. And I'm going to talk about that in just a minute. So really, this brochure is outlining key elements of Thriving Families, Safer Children. Just looking at that consensus, emerging consensus across the nation, that reshaping child welfare in the United States requires an explicit focus on prevention and equity, which will reduce disparities and outcomes for children and their families. Looking at co-designing with families and community members, visioning and working together to identify goals, desired outcomes, strategies, as well as support around implementation that could include funding. So let's see. So the goals, just to emphasize, the goals of this initiative support the ongoing work underway in Oklahoma to transform the child welfare system into a child and family well-being system. And as you can see on the brochure, there is a robust team of supporting partners there. I think that's really important to underscore there, including family members and community members. Let's go to the next slide, Brett. So through extensive planning, there were 7 communities identified to begin this important work. And meetings have already begun with community coalitions in LaFleur and Oklahoma County, specific to Northeast Oklahoma City, engaging families with lived expertise, those community stakeholders and partners to begin co-designing that framework to improve child and family well-being. We really need to understand community needs as defined by the community. And those pathways to achieving the vision of thriving families, safer children will be shared shortly here. But first, let's hear more from Renata about one of those communities.
Thanks, Janelle. So yeah, whenever I was at the Seesaw meeting and I heard about the Thriving Family Safer Children initiative, I was so excited to bring it back to my local coalition. So I came back and discussed that, you know, we were one of the 7 identified counties that they had talked about at the Seesaw meeting for the Thriving Family Safer Children. So I brought that back to the coalition and got them all excited about it, and they were so interested in hearing more about it. So I went back and invited the entire Thriving Family Safer Children team down to LaFleur County to come and talk at our local coalition so that they could better explain it. So when they got here, it went really well. We had a big crowd that day, and we had a lot of buy-in. And so really, literally immediately following the coalition, we stayed over and we were able to develop a steering committee. And I got nominated to head that committee, I guess, because of all my excitement about what could possibly come to our county, and knowing that they were going to actually reach out and get family voice and have that at the table. So I gathered up some parents that have got current lived experience, and we've started that. And we actually, they interviewed with Jeff and Joni, and Jeff Talent with Evolution Foundation and Joni with the Oklahoma Family Network, interviewed them and then talked about how they would compensate them for their time and energy spent with bringing their voice and stuff to the table for us. So we started planning with those parents that were identified with or interviewed with Joni and Jeff. We have now started working to develop listening groups. We're getting other parent voice throughout the county that are interested in coming to the table and us having a listening committee. So I'm just really excited and so thankful for the opportunities and the things that you guys are allowing us to have down in our county.
Great job, Renata. So yeah, just tying into everything that we've been talking about, from what Brett said, Janelle said, Renata, I was brought on to this in January, and ever since I was brought on, everything has just been moving and moving at a fast pace. It's a lot of hard work, but I'm gonna really try to explain this so everyone can understand. So this is what it's looking like as we go in through the community. So the Evolution Foundation and the Oklahoma Family Network, they're going into these communities to meet with the coalitions that they built and really build up the support for Thriving Family Safer Children. Each of these communities, they're going to look different based on their location and access to resources. And we're going to be working with these coalitions to bring the right family members with lived experience and community partners to the table. We really need an equitable demographic representation of families in relation to culture, race, and ethnicity. And then we're going to meet with these coalitions and subcommittees of the coalitions to plan these listening and visioning sessions. And we'll talk more about this in a minute. The community coalitions, we're going to be looking at data together to assess and gain a better understanding of the community needs. We've pulled data from Casey's Family Opportunity Map for each community. We've pulled national child welfare data for the 7 communities using stunning charts and heat maps. This is my first time ever seeing, to really get a snapshot of what the community looks like and create a local community profile with key indicators related to children and families. And then we're going to have joint action planning between these community coalitions, minority board members, families of the peer-to-peer network, and Thriving Families Safe for Children subcommittees to improve performance on those key indicators. We really want to look at what's happening in the community. Our goal is to develop support, resources, services, and approaches to meet the unique needs of the families and promote the conditions to help them thrive. This work will focus on creating and enhancing networks of community-based support and aligning government resources to provide a full prevention continuum that strengthens community protective factors and parental protective capacities and mitigates some of those associated risk factors. So we're going to be listening to the community, and as far as that, when we listen to the community members is going to provide insights to potential opportunities and needs. We're going to be working alongside with community leaders and co-create agendas and follow the lead's guidance on how to engage with that community. We will listen to our community members with lived experience through the lens of race equity to provide insights to potential opportunities and needs. And then we're going to co-create with system partners to shape a shared understanding of the pathways needed to improve child and family well-being communities across Oklahoma. Go back, Brett. Yeah, so what does these listening and visioning sessions look like? So we're going to be using co-design. We're going to be co-designing with the community to help them build their own solutions. We're going to be using a human-centered design approach, which is a creative approach to problem solving. Co-design is a collaborative process where problems are solved through the use of participatory design methods and power sharing. It's a type of human-centered design that focuses specifically on direct design with communities in which the solutions live. It focuses on solving customers' problems and users' pain points and building solutions around those. Human-centered design can result in new objects, ideas, narratives, or systems. And these ideas result in a more equitable practice. They're more likely to be maintained, and you get better ideas from more people. So what does these listening and visioning sessions look like? So we really want to start off with a level setting session. We want to build trust with the community, make sure we get the right people to the table. We need folks who are never considered or thought of, who was not at the table, who never had a chance to be at the table. Find out from that community what makes them comfortable. How would they like to format the listening and visioning sessions? And we really want to create a common understanding and think through where we're trying to get to. What does prevention mean to you? Define what success looks like for your families and communities. And then we'll go into our listening sessions. With these listening sessions, we'll ask specific questions related to their experience or on a specific topic. The goal is to understand the opportunities and challenges surrounding a topic as families themselves perceive them. And then we'll use this information to determine what changes or actions we need to take. And then we'll go into visioning sessions. When we go into visioning sessions, we're going to use visioning exercises that allow families to express ideas about their future of their community and create a shared community vision. We're going to ask the group where they are now and where can they realistically expect to be in the future, and we're going to develop a vision together. The goal is to develop written and visualized statements of the community's long-term goals and strategic objectives, and then we're going to take this information back to stakeholders and take action on areas where we can help the community improve. So that really goes into what these listening and visioning sessions is going to look like. And this work isn't about power, it's about public good. We see the impact of adverse childhood experiences, acute and chronic stresses on families, and longstanding community inequities and how they've manifested in a number of ways. So we really must take action on this opportunity to support communities in developing inclusive, equitable, and more effective networks and partnerships that will prevent the trauma of maltreatment and ensure all children and families have the opportunities and supports they need to thrive. Yeah, I think that's pretty much it, everything that I had to say. thank you all for showing up today and working together to help shift our state forward for our children, families, and communities. And if you know anyone in any of these communities, get involved with us and have them reach out to Brett or I, and we'll take action. Thank y'all.
Thanks, Tavon. So that really reflects what Thriving Families, Safer Children is. We're super excited about this work and all the support behind it. And with that being said, I will turn it back to, I believe, Dr. Shropshire.
Yeah, thank you guys so much. And I'll tell you what, I was just reflecting as I was kind of listening to this again. I've been a bunch of meetings about it and all this kind of stuff, but even just listening to the little snapshot that you guys provided today, it just gets me jazzed up again. I don't think we have been in a more exciting time kind of in our state around this issue of kind of child abuse prevention, family strengthening. I will tell you, so like I have sat in a lot of meetings where I was a stakeholder, we invited stakeholders and we sort of talk about how we partner with the community and that kind of stuff. I've never seen it be as serious about being community led and voice of the people served, being the leaders and state agencies, really being, in a sense, the support as I have seen it right now. And I think this project is evidence of that. I had a teacher, someone who had been in community work at OCCY and then at DHS, who Brady Smith, who taught me some 8 years ago or so how you really see change in communities, and it requires community leadership. And I would say the piece that we didn't have right back then, but is really being added, is the voice of the people who are being served. And as a leader in a state agency, I'm committed to this not sort of being one more thing that 5 years from now we look back at and say, well, you know, y'all talked a good game, but actually this work being driven by the community and driven by the voice of people we serve toward change, and us being the support players on that. And so it's a super exciting time. If you're in one of those communities, step in and get involved. It will be a really incredible opportunity to speak to what your community needs and to play a role in that. And so really exciting stuff. And I got to tell you, I got to say thanks also to the health department for partnering with child welfare on this particular meeting. There were a number of folks who were involved in kind of getting this set up. We're actually going to finish a little bit early, which is amazing for such rich content that I think we had today. But we did this, we started partnering on this meeting about, I don't know if it was 2 years ago, 2.5 years ago. I think this is our fourth one or maybe our fifth one. I don't know that I can keep it straight, but the conversations are different than we used to have before we partnered, even around this meeting. And so, Lori, I'd say to you and your team, thank you so much for kind of letting us crash your party and be involved and working closely with us, and to Keith and Sherry and Lachey and Kat, those of you who kind of actually make this thing happen, do all the hard work. I really appreciate it. I do want to mention a couple of quick things. I know y'all talked a little bit. I know we talked a little bit about Child Abuse Prevention Month activities. There are a number of activities that are planned, and you can find a lot of them on the health department site. But obviously today is sort of Wear Blue Day, so be sure and take a selfie and post that on social media. There's lots of there's like frames and all the different kinds of things that you can do to frame your picture on social media. The Skydance Bridge is going to be lit up on the 11th of April for Child Abuse Prevention. The lights will go blue for Child Abuse Prevention Month. There will be a Child Abuse Prevention Awards of Excellence ceremony at the Capitol, so check that out. That's on the 21st. The Child Abuse and Neglect Conference I mentioned is the middle of the month, the 13th through the 15th, and a lot of different activities going on there, including a specific prevention track and just a number of other activities. YMCA is having activities later in the month, and so lots and lots of things that are going on. Both around the state and here around Child Abuse Prevention Month. Lori, I know we've got a poll question, but before we get to that, is there anything else that you want to say to the group?
Oh, I just want to echo your sentiments, and I thank you so much for partnering with us. We talked so much about collaboration today, and so I think hopefully that message is going forth. We're all better together when we work together and collaborate, and it's exciting, like you said, to see what's happening with Parent Voice and the community and getting feedback from the community. And I feel really positive about the direction that we're headed in. And thank you for going through those activities for Child Abuse Prevention Month. I will mention one more thing, because I know that they've worked on it really hard, the CAP Action Committee, but there is also a social media challenge. TikTok, you could do it on Facebook too if you wanted, but there's a TikTok challenge of creating a short video, and with the theme, all you need is love, and posting that. And we're hoping that we're going to get a lot of, posts and people sharing and making connections with that. So that's really exciting. I still have to do mine. I'm not going to lie. I'm not the greatest at that kind of stuff, but we do encourage you, have a lot of fun with it. And we just really want to highlight that, this month. But again, going back to our theme of, we want to strengthen and support families as we move forward, most importantly, and give them the resources they need early on to be successful. So that's really all I have to say, but thank you so much again for working with us and partnering with us.
Sounds great. You see on your screen a couple of different resources to be able to stay connected with us. I think you gathered some of those along the way in the meeting as well. We did go ahead and post the next couple of dates. This meeting happens twice a year, so you can kind of save the dates for the next couple of meetings. We do want to ask you, though, some preferences about how these meetings occur. There's real value to the reach of virtual meetings and the ability to bring people together from across the state. The flip side of that is there's also some real value to being in person. And being able to have more face-to-face relationship and catch up with people. Maybe I know when we have in-person meetings, I'm always like, there's the main event, then I have a bunch of side things that I'm also problem solving for. But we want to hear from you, kind of what you want the structure of these meetings to look like going forward. So Kat, if you'll throw that poll question on the screen, we want to hear from you. So everybody take a minute and do the poll. This will give us some guidance as we're doing some planning. And again, man, just got to say thank you to the folks who were heavily involved in the planning, because you guys did do a lot of work in the background. Lori and I get to just kind of show up and have fun. So we really appreciate you. All right, I got 35 of you that still haven't done it. So I'm going to give you about 30 more seconds, and we'll get everybody that is going to answer our poll, and then we'll end it. Awesome. Thank you guys. That'll help us so much with our planning. Keitha, any last instructions or things that we left out that need to be said?
No, ma'am. We just thank everyone for coming. We will be sharing that out. You'll probably see that come from Sherry Trice. She runs our list of, I think we're up over 800 now. So be looking for the PowerPoints, all the great resources that have been shared. And then the recording will also be available, and you'll be able to find that on each of our sites as well.
All right. Thanks, everybody. Have a great weekend.